from Beverly Weiss, Aaron Rodiger, Richard Weiss, Emily Taylor, and Sharon Kramer. Once again, any order is just fine. Just let us know who you are before you begin. Thanks. Oh, so first of all, use the mic there. Make sure it's so we can hear you. Is it on?
Okay.
Okay, good.
Okay. My daughter has had the disabling neuroimmune disease, myalgic encephalomyelitis, CME, also known as chronic fatigue syndrome, for over 16 years, and has been homebound for the last 2. ME, which is estimated to affect over 1 million Americans, the same as afflicted with Parkinson's and MS, is characterized by profound fatigue, cognitive impairment, sleep disorders, and chronic pain. Something as simple as brushing your teeth or eating can cause a crash. It is estimated that between 35 to 70% of those with ME are unable to work.
Stop your clock. That's just someone calling in.
Up to 25% are bedbound or homebound. It affects people of all ages, all racial and ethnic backgrounds, including children and adolescents. ME is known as a living death. There is no cure. Who was before, and I think I distributed some of the pictures of him after. He has to stay in the dark room, and the sound of voices is too much for him. At least 70% of the cases arise after a person had either an infection or a virus. Many Californians have experienced frustration with UC Medical's lack of awareness and ability to diagnose ME. And many have been misdiagnosed and treated incorrectly, exacerbating symptoms. In fact, my daughter's downturn in the last 2 years was due to an improper treatment. She lost 30 pounds, her job, and ability to earn a living, and is unable to ride in a car without covering her eyes as the visual stimulation is too much. There are currently only 4 specialists in California, 1 at Stanford, 2 in Mountain View, 1 in Torrance, and wait times are over a year. From the Institute of Medicine report, which I distributed, this is the quotes, many healthcare providers are skeptical about the seriousness of ME/CFS, mistake it for a mental health condition, or consider it a figment of the patient's imagination. The committee stresses that healthcare providers should acknowledge ME/CFS as a serious, chronic, complex, systemic disease that requires timely diagnosis and appropriate care. We feel it is imperative for physicians, nurses, and other medical personnel to become familiar not only with the symptoms, but to also gain a better understanding of the impact of ME/CFS and on the impact that it has on those who are stricken with this life-altering disease. I'm sorry. You are a state-funded university. The 100,000 plus Californians afflicted with ME, their friends and families, are asking that the UC medical system, 1, please partner with us to bring safe and effective clinical care to the way people with ME are treated at UC medical centers. 2, please commit to training your physicians about ME and begin offering diagnostics and clinical care to people with the disease with up-to-date and accurate instruction on ME in all of its medical education curricula. Require at least 1 CME continuing medical credit course in ME for all healthcare providers. I provided a list. Screen the documentary film Unrest, which is part of one of the CME courses.
Thank you.
Thank you.
Hi everyone, I am Erin Rodiger, and I am the U.S. Advocacy Manager for ME Action, and Bev is one of our wonderful volunteers and advocates, so thank you so much for having us be here. As the Advocacy Manager of ME Action, I really ask of you to take ME seriously, believe people with ME, and add a focus of medical education on ME. I want to read you a story of a young woman who lives here in LA and who is actually treated at the UCLA ER. She can't be here because of with ME, a lot of people actually aren't able to leave their house. So I just want to read her story so you get a better understanding of what it's like. I have been 90% bedbound for 2 months and unable to leave my apartment, except a handful of times to get a doctor, and I've even had to cancel a few appointments because I was too weak to walk outside. She is really thankful for her friends who have been able to bring her groceries and done her laundry, just normal daily things that we take for granted. Her story also continues that what happened was that she had complications from a basic surgery 4 years ago and was under anesthesia hours longer than expected and was completely crashed her body to where she was paralyzed for a few days, unable to move anything or open my eyes or speak. And then I was unable to walk for 6 weeks and felt like a debilitating flu symptoms. She has been hospitalized 3 times, which includes last year at UCLA for 2 weeks. She's had to take off at least a year of work to recover and was feeling great for about 2 to 3 months and no problems. So she went back to work in February, starting about only 16 hours a week. She's a hairdresser, and she completely crashed again for 2 months ago. However, she's not recovering this time like she usually does. She's declining around the clock and has felt unbearable. She can barely get her words out for about a month now. So about 6 weeks ago, she felt better enough to go to the grocery store, and by the time she got to the checkout, she was so weak that she could not lift her groceries out of the checkout and completely crashed again. This last Sunday night, she started feeling better again, so she went to church on Sunday evening for the first time in 2 months, and when she got home, crashed again. So the surgery damaged her cells, and they are no longer producing the right amount of energy to function properly. And so she wants to say this to you guys. I can't begin to tell you how scary this is. I have left with a condition that does not have a cure and is becoming more progressive, and people can be bedbound for months or years or the rest of their lives. And in the worst cases, their organs even lose the ability to produce enough energy to function. So it's like an old cell phone battery that can't hold enough charge and easily dies. So again, I want to reiterate the ask that Bev shared just prior, but to please include ME in your medical textbooks, to require CME credits for your nurses, doctors, social workers, and also if you're interested, we have a documentary called Unrest, and we'd love to have a screening here on campus. So thank you for your time.
Thank you.
Hello, UC Board of Regents. Thank you again so much for having public comment during these sessions. My name is Emily Taylor. I'm speaking in 2 hats today. One is a caregiver of my mother who has had ME since 2008 and had a pretty negative experience at the Jewel Stein Institute here at UCLA, and also as the Director of Advocacy and Community Relations for the Solve ME CFS Initiative, an education, research, and advocacy group for ME and CFS specifically, located here in Los Angeles. I think you've heard some of the devastating stories about what ME can do to people's lives. The long and short of it is it's a neuroimmune disease, generally triggered by a viral infection that can really happen to anyone of any age. There are pediatric cases and cases all the way up to the age of 80. As Beverly mentioned, over 100,000, estimate up to 300,000 folks in California have this disease, and UC medical centers are some of the best and the focus of so much healthcare here in the state, and we're really looking to you to help us in this fight to bring education and awareness about this disease. The Solve ME CFS Initiative, as I mentioned, is an advocacy, research, and education organization, and we also sit on the UCLA Transitional Science Institute board, where we help represent this community and provide guidance for how you can work with these patients who, as were described, are generally homebound or bedbound and have trouble participating in clinical trials, getting access to medical care, even getting to the doctors. And when they do get to doctors, less than 30% of medical textbooks or curriculum even cover ME, so they're often dubbed as hypochondriacs or misdiagnosed as mental illness, when truly this is a devastating neuroimmune condition that is really marked by inflammation throughout the body. And I bring this up because to treat that inflammation, my mom was treated with prednisone for 4 years, and it was one of the only drugs that managed to mitigate her symptoms. As many of you know, prednisone has a side effect of creating cataracts in your eyes, and she lost her vision. For my mom, this was particularly devastating because she loves to read, and being unable to read Braille, she really was unable to have that experience in her life. So we went to the Joel Stein Institute looking for help to remove the cataracts, and I was specifically told by several nurses as we were doing our intake process, don't mention this disease. If you mention it, they're not going to help you. Just say you have an autoimmune condition. And so it really is the misinformation and misunderstanding is hurting patients daily. And it applies to all different areas with specialties from your eyes to your toes. So I really just implore you and offer our services as an organization here in the area that we have, we're about to launch a patient registry, the first of its kind that's international, with a login app that you can use on your phone for people who are disabled. We think that this would be an amazing tool to help collaborate with researchers, bring the data to the researchers, and your health facilities could be a great launching point for that. So again, really, I want to emphasize that you have, in solidarity with our partners at ME Action, we have 3 of the only organizations in the United States working on this disease here in California, and we can all be of service to you if you choose to take up this important issue. Thank you again for your time.